Good morning and welcome back. My name is Alyssa Bierbaum, and I'm one of the Special Projects Editor with the Duke Environmental Law and Policy Forum. Before introducing our next monitor, I'd first like to thank our distinguished panelists and moderators for both their participation and their ongoing commitment to the field of children's environmental health. I would also like to extend a huge thank you to Paul Graves and Christian Dysart for their invaluable work in organizing this event. We are very fortunate to be joined by Tim Profeta as moderator of Panel 2. Mr. Profeta is both a graduate of Duke Law and the Nicholas School. He has served as counsel for the environment to Senator Joseph Lieberman and was a principal architect of the Lieberman-McCain Climate Stewardship Act of 2003. Mr. Profeta is the founding director of the Nicholas Institute for Environmental Policy Solutions. It is the vision of both the Institute and our symposium to further dialogue and identify proposals that address critical environmental challenges. Without further ado, Tim Profeta.
Thank you, Alyssa, and thank you for that kind introduction. I'm not going to take too much time up here. I just want to give a little bit of the context on this issue from my perspective and introduce our fine panel. And I think we'll have them come up one at a time so they all can see each other's presentations. I feel like over the past few decades, I've personally seen the evolution of the field of children's environmental health. I was just telling Professor Wargo, it started in his class when I was an undergrad at Yale and working on projects with pesticides and the effects of immunotoxicity, reproductive toxicity, and the like. Working here with Jonathan Weiner through risk regulation and the whole concept of sensitive subpopulations that was a rallying call in fighting back the regulatory reform proposals in the 104th Congress. And then in the past 10 years in DC, 5 in the Senate, seeing the resonance of this issue. And I think, this issue, we should be not too skeptical about the political power of this issue. It's one of the most, politically powerful issue in terms of grabbing the attention of a policymaker if we can do it in the right way. I think, first of all, most of these legislators see their policy role sometimes through the eyes of a parent, and I can think of a couple of examples. When Barack Obama came to the Senate, he had no interest in air regulation or mercury regulation or ozone regulation or PM regulation. He just had no interest. That wasn't where he had spent his time. But he had an asthmatic child, and it was through the eyes of being the parent of an asthmatic child that we were able to really draw him into the committee's process, and I think he'll be an effective champion for years to come. Mary Landrieu in Louisiana, my old boss, Joe Lieberman, always says she's a mom first and a senator second. If you can get to her through the mom, then the senator sometimes gets pushed aside. So I think we can't underestimate the power of this issue in that regard. And then also an issue, I was just listening to that last panel and thinking about the economics of this. There's a gut sense in people's, in policymakers' gut, I guess, at this point, that what we're doing here is we're messing with the next generation of productive adults. I was just talking to Ann from Hillary Clinton's office about how her boss is looking at lead and its connection to juvenile delinquency. But can we correlate the more greater residents in our jails with greater lead poisoning? We need to figure out how to make that connection really live for people who are making policy on the ground. So in this panel, as we were designing this program, and I was talking to Alyssa and the DELPF folks, we thought, as we discuss what, if anything, we can do on these issues, and what can we do to use John Wargo's words from last panel about things that are slipping through the federal cracks? What can we do on the regional and the local regions areas? What can universities do? I think we need to first understand the status quo, some of the case studies on the ground, see if there's success stories and lessons that can be scaled and translated across. And that's really the purpose of this panel. I'm going to introduce our speakers in sequence. I first want to introduce Katherine Shea, Dr. Katherine Shea, who is a board-certified pediatrician with special training in preventive medicine and environmental health. She also has the triangle trifecta, I noticed from her resume. She's an adjunct professor at Chapel Hill on the adjunct faculty of Duke. and works part-time at North Carolina State. So during basketball season, I have no idea how she handles that diplomatically, but it's quite impressive. She has an incredible range of experience in these issues, working on issues from the World Health Organization level all the way down to our local public school system. And so, Dr. Shea, I appreciate being here, and thank you.
Well, thank you very much for inviting me, and I'm delighted to be here. I get an easy job compared to my colleagues this morning who all had very dense and difficult assignments for 20 minutes. I'm just telling you a story, and it is a success story. I was asked to talk about, and there it is, the School Children's Health Act of 2006 and my part in it. And because all politics is local and all progress is personal, I'm just going to tell you about my role and sort of how a pediatrician and a mom ended up walking the halls and helping get a law passed, which is not something I ever thought I was going to do. So let's first of all start out with the concept of healthy school environments. Schools are environments under public control, and it makes a lot of sense to try to promote children's environmental health by keeping schools as environmentally healthy as possible or minimizing exposures. And you can do that by preventing absence and illness and absenteeism by, for example, improving indoor air quality, for people who have asthma and respiratory problems, reducing exposure to diesel fumes, which you talked about this morning, and a variety of other chemical exposures which have impact on, for example, respiratory health. We want to provide safe school grounds and prevent injury. We want to prevent as many potential harmful exposures as possible, including to things like pesticides, metals, and UV light radiation. And there are things that you can do environmentally which actually promote learning, for example, minimizing noise exposure by siting schools well and minimizing traffic exposure, which actually promotes verbal learning, and there are data on that. The CDC has, for a long time, had a model called Coordinated School Health, which involves 8 major components and a lot of different professionals in trying to promote healthy school environments and keep children learning and in school. And you can see that healthy school environments is one of those components. And that's kind of where I enter the picture as a pediatrician, a children's environmental health person, and a mom. So my involvement actually in the School Children's Health Act started back when my daughter was in elementary school, and I became sort of semi-enraged because I thought she was watching way too much TV and too many videos in class. So I approached the principal at my local elementary school and asked if I could give a presentation to the faculty about the dangers of excessive TV watching, which I did, and it met with an immediate response by the faculty, and they changed their policy on the spot while I was watching, and the videos stopped and the TV stopped, and I thought, wow, this is pretty cool. So I decided to tackle something that was a little bit more difficult, which was the pesticide use, which I had also observed in my child's classroom and smelled. I put together a sort of a little package, which I thought was really creative and cool, to have the AG classes at the elementary school do an industrial hygiene project to identify what chemicals were used in the school, research the potential health effects, and then propose to the faculty and to the school district ways to monitor and minimize those exposures. But it got nixed at the district level because I wrote in there that I thought they should write a report, and they thought I was suggesting that they were research subjects, and so they sort of totally nixed the whole thing. But out of that exercise, my principal decided that I should really join the district school health advisory committee, and she invited me to do that, and so I did. So in typical small town serendipity, because I do live in Chapel Hill, which is who I'm compelled to root for during basketball because my entire family are Tar Heels, although I went to Brown, so I'm very neutral. I did join the School Health Advisory Committee, and it turns out that the Chapel Hill Carborough City Schools has the oldest school health advisory committee in the country. It was run by a woman named Susan Spalt, who was actually named the Health Educator of 2004, which is a national honor. And her husband was the founder of a small NGO which was dedicated to pesticide reform in North Carolina. So she was a very receptive audience and actually had been trying to get pesticides and integrated pest management onto the agenda but had not been successful. So my entry into the School Health Advisory Committee, in addition to a receptive sort of leadership and a brand new assistant superintendent in charge of buildings and grounds, was sort of good timing. I wrote a little 2-page blurb on children's special vulnerabilities and gave sort of simple references, many of which were EPA, including the really nice EPA Integrated Pest Management Manual, which is on the web and has been around for a number of years. Submitted it to the superintendent, and then Susan and one of the other committee members and I met with the superintendent. He had read the paper and was already convinced of the importance of IPM in schools based on what I had written, and had very practical questions about whether or not it was feasible, affordable, effective, how you would do it in the school. We were able to take him on a tour of the IPM program of the city of Carborough, which has actually been in the federal news and is very effective and was quite mature at that time. And that resulted in immediate changes at the district level. So I had partial but not complete success at this level. Then when the contract for pesticide, for pest control at the district level came up for renewal, a number of important changes were made, including sort of a ban on treatment of nuisance pests. They had been treating school grounds to kill crickets, for example, because they made noise, and that was stopped. Indoor baseboard spraying in the classrooms was stopped, and all calendar-based spraying in the schools was stopped. Many schools still have calendar-based spraying. They just come in and spray once a month, whether you need it or not. But I couldn't get the next step. I couldn't sort of encourage the district to do the next step, which was actually to institute a written, formal, permanent IPM policy, because there was a lot of concern about fallout from teachers and individual schools who were used to having their can of Raid underneath the sink and being able to get it out and spray, or call the district and say, I have one ant. And rather than clean up the food particles that were sort of feeding the ants, just have the district come in and spray. So changes on the ground happened, but no policy change happened. In the process of sort of that, I became involved with the NGO that was doing pesticide reform around a proposition that came from industry to weaken the aerial spray rule in North Carolina. And so I kind of got recruited into this ad hoc committee of organic farmers and health people and NGOs to try to formulate an approach to defeat this weakened rule. And I ended up actually reading the North Carolina pesticide law, which is not something that most clinicians do, learning a lot about regulations in North Carolina and how they work, reviewing drafts of the rule and commenting on them from a children's environmental health point of view. I ended up making a formal presentation about children's environmental health and pesticide exposure and risk to the director of the state health department and the state epidemiologist and the state toxicologist, as well as to the North Carolina Pesticide Board, and participated in a letter writing campaign, and basically we killed the bill, which was very, very exciting. And as probably in a state of euphoria because we'd been so successful, I actually was talked into joining the board of this little NGO, so now I'm the vice president. And the good side of that is that I became acquainted with the wonderful advocacy groups in North Carolina, particularly the executive director of ARC Pesticide Education Project, Fawn Pattison, who is a young woman of great energy, as are many of the people in the advocacy NGO world. Very idealistic, very effective, very high energy, very capable. And she had taken this NGO that had been sort of withering on the vine after 18 years of going in one direction and sort of revitalized it with the support of the then longstanding board, with a concentration on children and children's health, social justice, and really community-based empowerment of communities and people. She really is a master of networking and getting people involved in a topic which it touches on their area of expertise but may not be one of their primary areas of expertise. And she also is an excellent watchdog and really values making change at the policy level. So one of the things that she designed before I joined the board, and which I helped to sort of facilitate and write, was she started a project called Toxic Free Schools, which began with a survey of the 116 school districts in North Carolina, which was initially a mail-out and then a follow-up phone questionnaire, where they were just trying to scope what was being done to promote, to control pests in the state, what sorts of techniques were used, how expensive it was, and how effective it was. They ended up getting 60 out of the 117 schools to respond, which is actually pretty good. And some of their key findings were 43% of the schools that responded were regularly spraying pesticides in classrooms. 17% were actually fogging the schools, which is, setting off a bomb of pesticides and letting it just sort of drift all over every surface available. Only 3% were notifying parents when pesticides were going to be used. And they also found a very interesting but rather soft statistic, which is that when schools could make an estimate of how much they were spending on pest control, and that was very iffy because a lot of them didn't keep those records. The average amount per student was $1.77 per student per year, but those schools that used some form of integrated pest management actually spent less and had more success in terms of controlling pests. So this ended up being pretty key information for the next part of this story. And then with this as a jumping off point, the program coordinator, Billy Carroll, has been going out to individual school districts in primarily the eastern and the central part of the state and generating interest at the school district level for IPM in the schools based on which schools they identified in the survey were not doing much in that regard. And we have discovered that a formula of increasing community awareness of the science and risk of pesticides, the local use and cost data, the fact that there are practical, affordable, effective interventions that can substitute for pesticide use, and getting parents jazzed about the health consequences, potential health risks to their children, and making demands of their local school boards has been really effective in getting individual districts to adopt IPM, and there really are success stories virtually every month now, which is pretty exciting. Unfortunately, Chapel Hill Carborough City Schools still doesn't have an IPM policy, even though Durham does, and Wake does, and Orange County does, but we're taking care of that with the next part of the story. So there's also another sort of group that works on IPM in the state at one of my other affiliations. NC State is a land-grant university, and they have an extension program which is devoted to integrated pest management for North Carolina schools. And in 2004, with the encouragement of the people on their board, and Fawn at that point sat on their board, they developed a memorandum of understanding among a bunch of stakeholders to encourage and support IPM in all of the public schools. And those stakeholders include important people, not only NC State, but also the Department of Public Instruction, the NGO on whose board I now sit, the Department of Health and Human Services, DENR, the School Board Association, the School's Plant Maintenance Association, and importantly, the Pest Control Association. So they got the Pest Control Association to buy into IPM, which is pretty incredible. So then comes along a brand new representative, Mr. Greer Martin, who is a Wake County representative, who is a Democrat, who was elected in a Republican district. And he, recognizing his constituency was sort of heavily loaded with soccer moms, and I count myself as a soccer mom, so I don't think that's a derogatory term, wanted to do something that had an environmental focus but also concentrated on children and health. And he had become aware of the MOU at state and thought that was a good jumping off point for a bill. And so he assembled a bunch of sort of stakeholders and supporters and began drafting a bill that looked at various aspects of environmental exposures in the public school system. And importantly, he involved key stakeholders very early in the process, so they had lots and lots of input in what the bill was going to say, how it was going to say it, and could raise their objections and get them addressed before they were sort of blindsided in the committee process and in the legislative process. And in this group, he included also the Department of Public Instruction, the School Board Association, and the North Carolina pesticide applicators. It turns out that he did more than pesticides. And so his bill addressed arsenic-treated wood. Arsenic is a poison and a human carcinogen, and there are some data that suggest that it's also a neurotoxicant. Diesel bus fumes, and I don't know if any of you are not parents, you may not realize that that diesel is loaded with particulates, and many of those are also carcinogens, and that lots of times school buses wait nose to tail with their engines idling, and the levels of diesel fumes and particulates within the schools, within the buses that the kids climb into are extremely high and very dangerous, exacerbate asthma and also pose long-term health threats. Integrated pest management, including notification of parents. The elimination of elemental mercury, which still is in some classrooms left over from a long time ago when it was used in science experiments, and it's a powerful neurotoxicant, and a very small amount can contaminate a whole school. You may remember the disaster in Durham just a few months ago when elemental mercury was brought into a school and they had to close down the school, and houses were contaminated and kids were sick. So getting that out is kind of common sense. And then also addressing mold and mildew, which is a big problem in North Carolina, not as a mitigation for schools that were already identified as having problems, because he recognized that that would be a very expensive mandate, but to ensure that the consideration of mold and mildew prevention and mitigation was incorporated in guidelines for new schools and renovations of HVACs. So we addressed all 5 of these issues and really tried to make them low cost, no cost, or even cost savings, so that there wouldn't be a financial barrier and an unfunded mandate imposed upon the school districts. It turns out that all of these were done in patchwork places all around the state, so none of them were new programs, but they had not been uniformly required or distributed. So there were some kids who were in very poor dilapidated school systems who had lots and lots of risk, and other kids who were in frou-frou rich systems who had very little risk, and he was trying to sort of address the social equity issues as well. So they kind of recruited me into helping lobby for this bill, and I really had I had a bit part. They assured me that it was an important part, but I really think the heavy lifting was done by the coalition and by Representative Martin and his co-sponsors. But I was able, through my connections, as I said, all progress is personal, and the head of the Pediatric Society was my best man at my wedding when we were trying to do this, so I just called him up and said, this is a really cool bill, you should support it, and he went, okay. And so the Pediatric Society embraced this bill. We worked in coalition with a number of other child and environmental advocates. All of us together wrote fact sheets and reviewed the language for all 5 of those areas, so that we had good information that was, one-pagers for the legislators, and made the packets. We collectively reviewed the law as it was being drafted and made suggestions and, identified issues. And then a couple of times I went and actually walked the hall, which is a fabulous experience if you've never done it. And I've done it at the federal level, and it's very formal and very hard. And at the state level, you just go and knock on people's door, and they say, come in. It's pretty amazing. I made a formal presentation to the House Environment Coalition And then I attended the committee meetings where the bill was presented as backup in case Representative Martin needed a medical person. He didn't. He did a great job. And I also attended a meeting by invitation as a representative of the Pediatric Society to help diffuse objections that the wood industry had raised about the bill. And we can talk more about that in Q&A if you want. And the upshot is that it passed the House and the Senate unanimously, was signed into law. The reconciled bill was signed into law in July, and it went into effect on October 1st. The IPM has a 5-year phase-in, so there are 5 years for schools to sort of develop their IPM and sort of get it in place. And the winners are kids in school, the staff, and the faculty are now going to be uniformly in North Carolina protected against these 5 areas of environmental exposure. And I think the keys to success, and it is a success story, although it's a story in progress, timing is definitely everything. And the stage had been set by the pre-work that had been done by the NGOs and by NC State, and by a number of school districts who had been leaders already and had proven that it was successful and cost-effective and worked well. And so being able to marshal those resources, network, and then lobby effectively using all of those pieces of the pie, I think, was very important. Preempting the opposition by involving the stakeholders in the process of drafting the law was crucial. We did get surprised by the wood industry's opposition, and that required some scrambling, but we were able to sort of meet their objections. One very tricky thing that was decided early on was to avoid the word environmental in the law. Because that would have put it into a different mindset and also a different committee structure. So it was called the School Children's Health Act. It went through the Education Committee in the House and the Health Committee in the Senate. And I think that was really critical. And then the sponsor and the coalition were very effective at combining the pros who sort of know everybody and know how to walk the halls with the volunteers like me and a number of other pediatricians who wrote letters and showed up and talked. But, you know, we were told exactly what was appropriate for us to say and what we shouldn't say. So it kept us out of trouble. It maintained our credibility, and I think it was really a very positive way to sort of use volunteers. And then throughout this whole process, there was, you know, very active sustaining of a common vision of making the schools of North Carolina safer and more healthy for children on a uniform, equitable way. So we have ongoing challenges. We need to watchdog the implementation of this and make sure that people comply and assist in developing the guidelines for IPM, which will be done by the State School Board Association and then implemented individually in each of the districts as it makes sense for them. And then there are a whole bunch of other things that we may decide we want to tackle, which will also make the environments in schools more healthy for children. Right now, only about half of our schools are tobacco-free. They all should be. We need to work on sun protection because skin cancer is a big problem and exposures during childhood are important. We're working on the food concept in terms of getting more healthy choices available. We have a wonderful resource in that EPA has a flagship green building, and we can start thinking about making our schools more green. Walkable, bikeable access to schools will combat obesity and improve health. We could work on getting cleaner buses. And I also, my pet hope is that we'll be able to tumble all this down into daycares where the younger kids are exposed and are probably at higher risk. So that's my success story. It's a little easier to follow, I think, than all the science, and I'll be happy to answer questions in the Q&A when people have them.
Well, I don't think we could have a better example of what I was trying to say, not quite as eloquently as you, that the resonance of this issue, if you really put together the right coalition, really have you know, reach for the right heartstrings. Next, I want to welcome up to the podium John Suttles from the Southern Environmental Law Center. John is a senior attorney at SCLC, but before that was the deputy director of the Tulane Environmental Law Clinic. For those of you who don't know, one of the finest environmental law clinics in the country, one many people model themselves after. John also got to go to school at Tulane, so I mean, I count at least 5-10 years in New Orleans, so I'm also jealous of you for that because it's a fabulous city. But we're glad you're here now. John's topic is going to be the regulation of mercury and addressing some of the myths that we see in the debate over mercury. This is an issue, if there's any issue before us today that I spent a lot of time on myself, it was this one. And I know all these myths, but I will allow you to slay them. So come, John.
Thank you, and welcome to the dense, difficult story that Kathy alluded to. I'm going to violate one of the most basic rules of giving a presentation, and I'm going to do it twice by beginning with 2 disclaimers. The first is, if my title slide doesn't disclose this, I have a bias when it comes to regulating mercury pollution. I've spent the last 18 months, the better part of my professional life I've spent representing 4 national public health care groups challenging EPA's clean air mercury rule in federal court. We're pushing EPA to go further, faster to reduce mercury pollution to protect children's health because we believe it's necessary and it's required by the Clean Air Act. The second disclaimer is that this is a vast and complicated story, and I don't have the time to fully go through it, so I'm going to gloss over a lot of the salient points, hopefully. And if anyone has any questions, feel free to email me at that email address, and I'll do my best to address your questions. In the interest of brevity, I'm going to depart from this outline a bit, or boil it down. Really what I want to talk about is the problem of mercury pollution from coal-fired power plants, how EPA has addressed that problem, how EPA's approach is flawed, and then some of the ways that other states and regulators have done a better job of approaching the problem. So the issue is this: mercury is a toxic heavy metal. When coal is burned, mercury is released into the air, and when it rains, mercury is scrubbed from the atmosphere and makes its way into water bodies, where it works its way up the food chain into large predatory fish. And that's the primary human exposure pathway when people eat fish. When a pregnant woman eats fish, she passes that mercury on to her developing fetus. And the mercury affects the developing brain and can cause permanent impairments of cognitive abilities, learning abilities, and loss of intelligence points. So because the Clean Air Act required it, and because of these problems, in December 2000, the Clinton-era EPA issued a Federal Register notice in which it found that mercury was in fact a pervasive and serious public health threat, that coal-fired power plants were the largest sources of mercury air pollution in this country and in fact globally, and that as a result it was appropriate and necessary, and that's an important term under the Clean Air Act, it's appropriate and necessary to hold coal-fired power plants to the maximum pollution control requirements of the hazardous air pollution provisions of the Act, because the other sections of the Clean Air Act weren't adequate to protect public health. So once EPA made that finding, it charted a course over the next few years of developing a maximum achievable control technology standard. What this basically means is EPA goes out, determines what is the best technology available, determines the emissions rates that are achievable by applying that technology, and then requires all covered sources to meet that emission level. When EPA started developing this maximum pollution control standard, it concluded that we could achieve a 90% reduction of mercury emissions from all major coal-fired power plants by the year 2008. That would mean that we would go from current emissions levels of 48 tons per year down to 5 tons per year in 2008. But around the same time, we had an election, and we have a new administration, and we inherited a new EPA, which has a different approach to regulating mercury. It's adopted a market-based approach, which is known as the Clean Air Mercury Rule. The way this approach works is EPA sets a nationwide cap that goes into effect in 2 phases. In the first phase, that goes into effect from 2010 to 2018, nationwide emissions should drop to 38 tons per year. From 2018 and onward, the cap should drop to 15 tons per year. EPA then doles out allowances. 1 allowance equals the right to emit 1 ounce of mercury pollution. And all of those allowances add up to total the 2-phase caps. Power plants then have a choice. They install controls to reduce their emissions to the level of the cap that would apply to them or below that level. And then some sources are expected not to install any controls or not to install as effective a control. and they have the option of buying allowances to continue to emit higher levels of pollution. There are two pretty obvious differences between these approaches and one not so obvious but very important one. The obvious differences are that under the technology-based standard, we get to a nationwide emissions level of 5 tons per year by 2008. Under the market-based approach, we achieve an emissions level of 15 tons per year, which is 3 times higher, and we don't get there until 10 years later, 2018. And EPA even acknowledges that that 2018 target date is unrealistic, that because of some of the provisions of this program, we probably won't hit that target until after 2026. The not so obvious but very important difference is that under the technology-based standard, all sources are held to an emissions level that's achievable by the best pollution controls available. Under the market-based approach, some sources will reduce their emissions, other sources will buy allowances to continue to emit high levels of pollution. And this creates a danger of mercury hotspots. These are areas of local areas of high mercury concentrations and higher human exposures. So when EPA develops a rule like this, it does a risk analysis in a very basic way, and specifically in this case, the analysis boils down to what are the risks posed by pollution balanced against what are the costs of controlling that risk. EPA found that nationally, every year, between 300,000 and more than 600,000 children are born with unsafe levels of mercury in their blood. And this places these children at a risk of developing cognitive delays, learning disabilities, and loss of IQ points that will last a lifetime. Balanced against this are the costs of effectively controlling this risk. When EPA was developing its maximum pollution technology standard, it concluded that with technologies that existed in the 2000 range and technologies that would soon be available, that utilities could achieve that level of control from a technology-based approach at a cost of far less than 1% of utility industry revenues. So when we do the cost-benefit analysis, the balance seems to tilt pretty heavily in favor of protecting children's health when it can be done at an affordable cost using effective and available controls. But that's not the approach EPA chose. EPA took the market-based route, and there are 4 big reasons, I think, why EPA did so. Perhaps reflecting my bias, I call them myths, because I think they're fallacious. The first myth is that the mercury health threat, in fact, has been exaggerated, and this really boils down to a tale of 2 studies. A study was done in the Faroe Islands that examined women who had a consistent diet of fish, and that study found that mothers passed high levels of mercury on to their developing fetuses, that this caused irreversible impairment to specific brain functions in those children. And the study has been criticized because the Faroe Island women also consumed whale meat to supplement their diet. However, the study also showed that the average exposures of these women and their fetuses was similar to or below current U.S. standards. Furthermore, the results of that study have been corroborated by a later study in New Zealand that did not involve diets that included whale meat. On the other side of the equation is a study that was done in the Seychelles Islands, and that did not find a linkage between a diet that included fish contaminated with mercury with adverse neurocognitive scores on testing. But the National Academy of Sciences found that there were 4 big problems with that study. One, the study didn't use tools that were sensitive enough to measure cognitive decrements. 2, that the study didn't use tests that were age appropriate for the children that were tested. 3, that the cohort was not large enough to yield statistical certainty. And 4, that they pre-screened some of the test subjects and excluded some who had impairments without determining whether those impairments could be associated with mercury exposure. So it skewed the study. But beyond all that, the bottom line is, in matters of public health, when you have a test that shows adverse effects and another study that fails to replicate those results, the more prudent course is to set public health standards based on the results of the test with adverse health effects. But that wasn't done here. The second myth is that U.S. power plants really aren't major sources of domestic mercury pollution problems. When EPA developed its clean air mercury rule, one of the important assumptions in the rule is that only about 8% of the mercury that's emitted from a coal-fired smokestack deposits near the source, that the remaining 92% enters what's called the global pool and deposits thousands of miles away. And since sources in China and India emit far more mercury pollution than sources in the US, they were the biggest contributors to our problem. However, over the past 3 years, EPA has conducted a study in conjunction with the University of Michigan using state-of-the-art tools and reached a virtually reverse conclusion that, in fact, 70% of mercury deposition locally and regionally is attributable to local and regional coal combustion sources, including power plants. In a briefing to senior EPA-level officials, these researchers noted that this has serious implications for hotspots, and these are areas around coal-fired power plants where you have high mercury concentrations. Interestingly, the EPA Office of Inspector General also noted that EPA's clean air, in its clean air mercury rule, EPA had failed to demonstrate that the rule will not result in hotspots. The third myth is that even if we did reduce emissions from local and regional coal-fired sources, it really wouldn't do much to improve fish contamination levels or human exposures. And this is simply not true. When municipal waste and medical waste combustors also emit high levels of mercury pollution, and when Florida and Massachusetts required strong controls on those waste combustors, they found that within 10 years in Florida, with a 90% reduction of mercury emissions from those sources, mercury contamination levels in fish and adjacent waters declined by 80%. In Massachusetts, with similar regulations, fish tissue concentrations declined by 32% within 7 years. And so the lessons that we learned from these studies are that when we require stringent controls on local sources, we get results and we get them fast. And this should reduce human exposures. And the fourth myth is that even if all of that is true, we don't have the technology available to achieve these aggressive reductions. This is also false. When EPA was developing its technology-based standard back in 2000 to 2003, it concluded that with controls that were available then and would be available in the near term, we could achieve a 90 to 95% reduction of mercury emissions from pretty much every configuration of coal-fired power plant in this country in the 2010 to 2015 timeframe. Basically, there are two ways to go about this. One is a multi-pollutant control approach, and what studies have shown is that with the proper configuration of controls to reduce nitrogen oxide pollution and sulfur dioxide pollution, we can also achieve high levels of mercury control, anywhere from 86 to 98%. And this is a good option because it provides a lot of bang for the buck. These controls are expensive, but you're controlling a lot of dangerous pollutants with them. With the advent of mercury pollution regulations on the medical waste and municipal waste combustors and also with power plants, mercury-specific controls have also become more available, more effective, and cheaper. One of the most prevalent options is using activated carbon, which is just powdered carbon that's blown into the flue gas after the coal is combusted, and it absorbs the mercury and is then filtered out with particulate controls. And long-term tests of these technologies have demonstrated a 70 to 90% or better reduction in mercury emissions. The effectiveness of those controls are improving, and the cost is declining. So this brings us to kind of a policy consideration. Studies have shown that the timing and stringency of regulations directly affects the effectiveness, availability, and cost of pollution controls. And so when you have strong regulations that require an aggressive approach to pollution, the availability and effectiveness of controls improves, and the cost of those controls correspondingly declines. And this has, in fact, been the case in regard to mercury controls. In an 8-year span between 1997 and 2005, with the advent of mercury control requirements, the cost of mercury-specific controls has declined by up to a factor of 10 or more, while these controls have actually become more effective. So there are a number of states that have decided EPA's rule is inadequate and have taken a stronger stance. And Massachusetts, Wisconsin, New Jersey, and Connecticut were 4 states that early on adopted more stringent state-level mercury regulations. And these 4 graphs just depict the difference in control levels based on the federal standard and the state standards. The magenta lines represent the reductions that would occur in those states if the sources in those states chose to adopt controls to meet the EPA standard rather than going out on the market and buying allowances to continue to emit higher levels of mercury pollution. The blue lines represent what will be required in those states with state-level regulations. And we know that these reductions will, in fact, occur because they do not allow an opportunity for these sources to go out and buy allowances to continue to emit pollution. These are technology-based controls that require these sources to actually reduce their emissions in-state. That cumbersome acronym at the top is STAPA-ALAPCO. That is the largest organization of state, territorial, and local air pollution control officials in the country. And it responded to EPA's rule by concluding it was deficient and that it issued a model rule for states to consider. And under that model rule, with a technology-based approach, it calls for a reduction of 80% from all sources by 2008, and then a second phase, a reduction of 90 to 95% by 2012. And this more or less tracks the maximum achievable control technology standard that EPA began to develop back in 2000. It just delays the ultimate goal by 4 years. So I was worried I was not going to get through this in time, but talking like an auctioneer, I guess I've done okay. So the conclusion is, from our vantage point, when you have, even with some uncertainty that goes into all of these issues, but when you have a demonstrable and substantial risk to children's health, and weighed against that is the cost of addressing that risk with controls that are available, and they are effective, and they are affordable, then the balance should be struck in favor of aggressive controls to reduce mercury pollution and the risk to children's health. Thanks.
Thank you, John. I'd like to introduce now Marlin Miranda, who is a associate research professor in the Nicholas School of Environment and a good friend. Marlin directs the Children's Environmental Health Initiative at Duke, which I like actually how this is termed. It provides research, education, and outreach program committed to fostering environments where all children can prosper. Which, usually sometimes when we talk about our centers and our institutes, we get a little wordy. That boils it down really well for me, Marlin. This is a place where all children can prosper, and that's really our goal in this conversation today. Marlin's got an incredibly impressive record and has really become a person I value to go to on this topic, but also serves on a variety of boards and that span everything from the local level to the national and the international level, so it can give us a variety of perspectives. Marlin's going to talk to us today about how policy questions evolve over time, which I hope will set us up well for the afternoon, and how we can evolve them from here. Thank you, Marlin.
Thanks, Tim. My apologies for not being here first thing in the morning. I was flying back from the West Coast, and I last night before I got on the plane, I thought, I'll just call home to see how things are going. I called home. My daughter answers the phone and says, "We don't know where Daddy is. There's no water." And, my husband is a field scientist, and he regularly works off a 140-foot tower. So we don't know where Daddy is a little troubling comment. And so, I thought this morning I was going to get up, take the kids to school, have a, opportunity to do a few more things, but I took care of the water at our house. I broke into my neighbor's house, unbeknownst to them, so that I could take a shower, and was then heading here and had to go back because I got a call that one of my other children was sick. So the fact that I got here at 11 when this panel was supposed to start is not a sign of disrespect to my my longtime colleagues. It is, in fact, a sign of how important this is to me that I actually made it here at all. Daddy is he is safe and sound, and it's raining today, so there's no field work. Okay. So when Alyssa asked me to talk about how policy issues evolve over time, two of the natural ones to talk about are lead and mercury because they're so well studied. And since John was going to be on the panel, I thought I would focus on lead. I'll tell you real quickly a little bit about the Children's Environmental Health Initiative, or CHI. As Tim mentioned, we have a mission statement, which is help foster environments where all children can prosper. And I'm delighted that he can get our mission statement out as easily as everybody on my staff. We focus on kids. We have a particular interest in issues of environmental justice, which means that we spend most of our time working in low-income and minority communities. We're also very interested in moving children's environmental health programs from mitigative to preventive approaches. The standard operating paradigm right now is that we wait for children to get sick, and then once they get sick, we go into their homes, their daycare centers, their schools, their grandma's houses, and try to figure out what made them sick. Kathy's talk is a great example of, instead of waiting for kids to get sick and then going in and cleaning up the places, figuring out the situations and the places that are likely to are likely to be damaging to children, and getting it cleaned up beforehand. I think the work that she's done is really phenomenal in this regard. And our technical bailiwick is spatial analysis of data. And for those of you who know me, you'll know that I'm about to break out in hives because I'm going to do an entire presentation without any maps in it at all, which is very difficult for me. So just to make sure that everybody's on the same page about lead exposure, I know there are some people who don't regularly work on children's environmental health. Lead exposure leads to both symptomatic and asymptomatic problems. Symptomatic problems, if you went into, you would, if you had been exposed to high levels of lead, you would feel so unwell as to feel compelled to go to the doctor. And when you entered the doctor's office, the doctor could tell this person is sick. There are very few examples of symptomatic lead exposure, except for a handful of places here and there where we get some frank lead poisoning, either in industry or some accidental poisonings. Most of the lead exposure that we have in the United States is low-level lead exposure, and it tends to be asymptomatic because it affects things like your central and peripheral nervous system, your hearing threshold, your IQ, those types of things. And those are all things that are distributed within a population, so there's no way for a pediatrician to know when a child comes into their office whether this child has a poor hearing threshold because they sort of came into the world on that part of the curve of somebody who's got a poor hearing threshold, or who actually came into the world with a much better hearing threshold that was compromised by their exposure to lead. So it's much more difficult to sort of think about how we would identify it and treat it clinically, and therefore that much more important for us to make sure that we get in and prevent the exposures from happening in the first place. The primary source of lead exposure that we first worried about in the United States is lead in gasoline. Tetraethyl lead was added to gasoline to increase octane activity. With the passage of the Clean Air Act, when we were trying to reduce emissions of other contaminants, we require the installation of catalytic converters on all automobiles. And the thing about catalytic converters is that they don't work very well if there's lead in the gasoline. So we then had this movement towards unleaded gasoline, which I just have to say I think is yet another example of the federal government bastardizing the English language, because now we talk about unleaded gasoline. So what is leaded gasoline? Just think about it. What are pitted dates? Think about it. Just think about that. So we had these enormous gains associated with this. These are lead emissions from 1970 to 1997, and you can update them all the way through 2006. But then you sort of lose. Oh wait, I can't do that. Then you lose this clear sign of this rapid decrease in emissions that occurred from 1970 through 1990, and you can see most of the decreases from reductions in mobile source. So it's considered the greatest success story of air pollution control technology that we've reduced mobile source emissions by the levels that we have. And in fact, childhood blood lead levels track this very closely. In 1976 to 1980, the current CDC threshold, or the current CDC level of concern for health effects, is 10 micrograms per deciliter. In the late 1970s, 88.2% of children were above that threshold. I grew up in the city, in Detroit. I can assure you that my blood lead level was much higher than 10 micrograms per deciliter, and as were all of the children who grew up where I did. By 1988 to 1991, that percentage had been reduced to 8.9% of children above 10 micrograms per deciliter. And in the latest NHANES data, we're down to 0.8% of children higher than 10 micrograms per deciliter. That's 0304 data. And that's very impressive. We have this huge drop in mobile source emissions and a subsequent decline in the body burden of kids carrying around lead. So you sort of think, well, maybe that's the end of the story, but it's not the end of the story, because in addition to lead in gasoline, there's lead in paint. So lead was originally added to paint to brighten colors and increase durability. And the whole use of lead in paint was outlawed in many other countries almost 70 or 80 years earlier than it was in the United States. And we estimate, and it wasn't until 1978 that the Consumer Product Safety Commission banned the use of banned the use of paint that had greater than 0.6% by dry weight of lead in it. So there were a lot of houses built in the United States prior to 1978, and we currently estimate that there are about 50 million houses in the United States that still contain lead-based paint and pose potential hazards to children. So now you're talking about a housing problem, and if you think getting all the refineries to get the lead out of gasoline was a difficult enough problem, that's several orders of magnitude smaller numbers of refineries that you have to deal with, as opposed to the 50 million houses that still have lead in them. Well, in addition to these houses that still have lead in them because of lead in paint, some of these houses have lead pipes. And this is something that I wanted to make sure I spoke about a little bit longer, because it's in the news quite a bit. Now, I'm sure all of you are aware that we treat water for a variety of different reasons. We treat it to protect the public from microbial pathogens. We treat it to prevent dental caries. We treat it to decrease harmful disinfection byproducts, and we treat it to decrease metal contamination from pipes. So as a consequence, there are a whole series of things that happen at a water treatment plant. So we add fluoride of some type. We have these anti-corrosives. We have coagulants that are used to precipitate out fine solids. The anti-corrosives are to reduce the leaching of metals from pipes. And we have disinfectants, because we don't want people developing a whole series of diarrheal diseases when they drink their water out of the tap. Well, what has happened in the United States is that the traditional, is there actually a pointer? Is there a pointer? Yeah, okay. So what's happened in the United States is that we've disinfected water using chlorine. And one of the things that we have discovered in our environmental chemistry is that by disinfecting water with chlorine, we tend to produce trihalomethanes. And trihalomethanes have long been recognized as carcinogenic, neurotoxic, and teratogenic. Those are three fairly unpleasant words, not the type of stuff that you want to have in your water supply. So as a consequence, there are a whole series of municipalities that switch from using chlorines to treat water to using chloramines to treat water. And chloramines, what we're seeing is that there's a possibility that the use of chloramines, while we're not getting the production of trihalomethanes, the chloramines, particularly if they are used with some combination of anti-corrosives and coagulants, may be leading to the dissolution of these lead dioxide scales that have formed on the insides of pipes. So even though people have leaded pipes in their houses, for many, many years now, they haven't had any exposure to lead from that, because there's the scaling that's occurred on the inside of the pipe. So it's essentially this layer of protection that exists between where the water is and where the lead in the pipes is. With the introduction of chloramines, what we think may be happening is that there's a dissolution of this scaling that's occurred on the inside of the pipes. And as a consequence, the water can now come into direct contact with the pipes, and we see leaching of lead and other kinds of metals from those pipes into the drinking water. Now, there's no way for us to detect this at the water treatment plant, because when it leaves the water treatment plant, there's not lead in the water. The problem is when it reaches the homes that have the lead pipes or the lead elbows or the brass fixtures, those types of things where we get the leaching of the metals into the water. So, and the fact of the matter is that we really don't understand the environmental chemistry of this problem as well as we need to. We know that this corrosivity issue, that corrosivity is highly sensitive to very small fluctuations in pH and alkalinity, in temperature, in oxidation potential, and the concentration of other individual chemical species. So we have this, so whereas we originally thought about, well, there's this lead and gasoline problem, and then we figured out, well, no, we really need to worry about lead and paint as well. Now we need to think about the fact that the way that we're managing our water treatment systems has a big effect, may have a big effect on drinking water as a source of lead exposure, which previously we didn't worry about as much. And the routine monitoring that the EPA requires, which is every 3 years the EPA is required to go in and take 100 sample, any municipal water treatment system has to go to houses and take 100 samples. That routine monitoring completely missed the elevated lead levels in water in Washington, D.C., and in Greenville, North Carolina, the other place where we had a lot of elevated lead in water, and we're seeing some of the same things happening in Durham County, and we're really not quite sure why that's happening. My group is actually working with the state on this issue, trying to develop a better water sampling design for the state. So in addition to those, there are these what I'll call random sources, not random the way that my teenage son uses the word random, but random from the perspective of it's really hard to, there are these cultural sources, there are, certain foods that have been grown in lead-contaminated soil that have lead in them, there are toys. There was a very sad case of a child in Wisconsin who died this past year because he ate accidentally swallowed one of these little trinkets that you buy for $0.25 when you leave the grocery store that comes in those little bubble things that had very high levels of lead. I had this very difficult interaction with my mom the other day when she had bought one of these little trinkets at the grocery store for my 5-year-old, and it was all I could do to stop myself from snatching it out of my 5-year-old hand and, to talk very calmly. And my mom said to me, "Oh, Lynn, it doesn't look like it's got lead in it." It's like, okay. But, these are things where if you think about it, it's much more difficult. So the refineries, there's only so many places where we refine oil and make gasoline. The 50 million houses, well, it's 50 million houses and there are a lot of them, but, they don't move around. They're not traded. They're not shipped in different ways. And here you have, a whole series of things that are much more difficult if you think about it from a regulatory standpoint to figure out how to track them, how to keep parents informed, how to keep children safe from all of these things. So this is also one of these places where I think it's very important to remember this whole notion of the asymptomatic effects, that at very low levels of lead exposure, we may, in fact, be very concerned about children's exposure to lead. So there have been a whole series of studies done recently, perhaps best summarized by Gilbert and Weiss in a recent article in Neurotoxicology, that are recommending that the CDC threshold be reduced. It started many years ago at 60 micrograms per deciliter. It's gradually been reduced 40, 20, 10. There's a lot of debate right now about whether or not that level of concern should be reduced again. Some people have been calling for it to be reduced to 5 micrograms per deciliter, some as low as 2 micrograms per deciliter. This article in Neurotoxicology calls for 2 micrograms per deciliter. And work that we're doing in our group, which has linked the blood lead screening data in North Carolina to the end-of-grade testing data in North Carolina, shows effects of lead exposure on end-of-grade testing results at levels as low as 2 micrograms per deciliter, highly significant from a statistical perspective. So if you think about this, in 2003-04, if you take the CDC's current level of concern, which is 10 micrograms per deciliter, there are only 0.8% of children in the United States who are elevated above that level. Now, only is a difficult word to say in this situation because 0.8% sounds like a small number unless you happen to be the parent of one of those children or you happen to actually be one of those children in that very small percentage. But if you then said, well, what about this threshold of 5 micrograms per deciliter, what would what percent of children would be above 5 micrograms per deciliter? We estimate that there would be about 7.5% of U.S. children that are above 5 micrograms per deciliter. And if you talk about a new level of concern at 2 micrograms per deciliter, as some people are advocating, you're talking about 31% of U.S. children having blood lead levels above 2 micrograms per deciliter. So that's almost, so depending upon how you want to interpret and what you think is the right way to interpret all of this science, the statistics that are out there is only 0.8% of children are at risk, all the way to a third of our children are at risk for neurocognitive impairments associated with lead exposure. And one of the reasons that this is so important is because of some population level considerations. So if you think about sort of IQ decrements, for example, say a 4 or 5 point IQ decrement, if I brought all of you in here and did an IQ exam today, and then I brought you back 10 days later and did another IQ exam, you could easily have an IQ that was 5 point differential. That's within the bounds of the test. So you think to yourself, well, what difference does 5 IQ points really make in how people function? Well, again, I would argue if you were that kid or you were that child's parents, you might feel differently about, how big of a deal is, just a few IQ points. But the other place that I really want you to think about are 2 points on these curves. As I said, IQ, hearing threshold, learning and behavioral disorders, they're distributed across the population. And here the black curve is children who have not been exposed to lead, and the red curve are children who are exposed to lead. So you see this population level shift to the left of children who are exposed to lead. And there are 2 really important places to look at on this curve. The first place is down here at very low IQ levels. So if you think about it, just a small decrement in IQ can push children who might have been marginally functional and able to do okay in society on their own, all the way into the mental retardation category, in need of many more special services, creating a whole new set of challenges, a whole added set of challenges in the school systems. You also have, on this side of the curve right here, where you have very, very bright children who may easily be moved out of the genius category into the, still very, very bright, but not a genius category. And you think, well, how important is that? Well, if you think about the fact that in many, many states, North Carolina is a classic example of this, if you want your children to have access to advanced and intellectually gifted resources in the school system, you have to score a certain level on the exams, and there's no way of getting around it. So it's enough, a 2 or 3 point change on your end of grade scores, which we're easily seeing at levels as low as 2 micrograms per deciliter in the work that we're doing. Levels as low as that are enough to push you out of being able to get access to these kinds of resources. And if you think about the fact that the children who tend to sit on that red curve tend to be poor, and they tend to be children of color, we're creating, both on the low end of this curve and the high end of this curve, we're creating sort of signals and we're tolerating a set of circumstances which in my mind are hard to imagine that we should say are tolerable. So the policy levers that exist certainly exist at the federal levels where we have disclosure laws. There's the CDC level of concern that can be changed. There's the state level where we can think about blood lead screening strategies or real estate laws, and apparently some third bullet that I forgot to fill in. At the local level, it was a very, very rough 24 hours that preceded my arrival here. And at the local level, again, you can think about blood lead screening strategies. You can also think about housing code and prioritization of HUD dollars. And with all due respect to our colleague from Senator Clinton's office, my experience, as I think was part of Kathy's experience as well, is that at this point there seems to be more room to get action at the state and local level than at the federal level. The states and local agencies and community groups and advocacy organizations and nonprofits seem to somehow or another seem more capable of penetrating the sort of standstill that we're at on any number of children's environmental health issues. So I always like to conclude by acknowledging the funding agencies that support the work at CHI, and most importantly, I always like to conclude by thanking my 3 children who allow me to do the same thing at the office and at home, which is to try to create environments where all children can prosper. My son would tell you that I do that at home by imitating a drill sergeant from the Marines. But it works for me. But in addition to allowing me to do the same thing at home and at the office, my children help me to be a better person, and they help me to be a better scientist.
Okay.
What I like about Marlin's presentations is there are actually different pictures every time I see it at the back end, so I get to track her kids through time. We only have probably about, let's say, 10 minutes for questions, and so rather than monopolizing time, let me ask the audience first if they have any questions for our panel. Anything jump to mind? Let me assess the most general question from each of your experiences or things you described. What lessons do you derive for our process today in terms of how should, to use Marlin's title, how should policy evolve? What have you seen that makes you think that where the next frontier should be in terms of what we do on the issues you're working on or on children's environmental health in general?
I'll probably be the most general and basic, so maybe I should
Good.
start. Just in the mercury example, what I see is a huge disconnect between science and medicine and policy decisions that are made at the political level. And so I think better integration of the science and medical studies and conclusions into the political decision-making is vital.
You asked 2 different questions, I think. You asked what lessons have we learned and what are the new frontiers?
Well, and how could they be applied to the new frontiers?
Okay. Well, I can talk a little bit about what I was talking about on break, but I think one of the big lessons that I've learned is that it is sort of traditional, sort of environmental modus operandi to overdo the doom and gloom and underdo the solutions. And one of the keys to success is actually picking areas where there is doom and gloom data, which is rich and convincing, coupled with interventions that can change the future. And that's particularly important in children's environmental health when dealing with health professionals, because it's very hard to recruit doctors and nurses and nurse practitioners into an active participation in a process if you're asking them to tell their children essentially not to breathe dirty air. So talking to them about air pollution and asthma is a little bit more frustrating than talking to them about mercury air pollution, fish consumption, and policy change that will eliminate the need to have fish consumption guidelines. And so finding policies where, finding areas where you have good science or sufficient science, interventions that work in the short term, which will bridge the long-term interventions, I think is a key element in terms of recruiting increasing numbers of a broad array of individuals, including health professionals and policy people and the general public. In terms of frontiers, I think Dr. Wargo alluded to this a little bit when he was talking about the fact that we're sort of stuck in a loop of dealing with one chemical at a time and sort of standard human health risk assessment. And I personally feel on behalf of my children, who are really the reason that I put myself out in the world the way I do, as Dr. Miranda suggests as well. We have a limited time, I think, to make a big difference in the world, and I see the next 20 to 30 years as being pretty critical as India and China are rapidly industrializing and following the same path that the United States has followed. The consumption and pollution that's associated with those populations following our path is going to be devastating unless we do something big and different. And I think that we really need to work hard to involve not just sort of the ivory tower people who kind of get the science in great detail, but really work hard in recruiting the general population and lots of seemingly unrelated disciplines like artists and writers and comedians and performers and moms and poor people and rich people, so that they understand what the stakes are, and so that we can come up with new and innovative approaches and solutions which do not require the intense science-based proof which we have insisted upon for the last 20 or 30 years. I think it's totally doable, but I think it requires a major change in orientation and a really different sort of a set of choices about how we're using our resources and who we actually approach. And I'd be happy to elaborate later if people are interested.
So I'll just add that one of the big things that we emphasize at CHI is capacity building. We do a lot of capacity building work with local health departments and state health departments, community organizations, so that we build a lot of, for example, sort of sophisticated GIS models, and instead of building them and delivering them to local health departments, which we regularly do on a nice, seamless web interface that's really slick and you don't have to know all the stuff, we also try to develop the capacity in those organizations to figure out and bring the data that they have, the relevant data to bear in a compelling way. And that is related to our belief that that even where good science exists, and I happen to believe that, and I think Rout and Kathy would agree with me, that there's very good science that exists regarding for example, lowering the CDC level of concern on lead, but we have a CDC scientific advisory board that includes a person who testified in the Rhode Island lead paint litigation that blood lead levels of 40 to 60 micrograms per deciliter were not harmful. Now, I don't know how you can defend a statement like that.
Except that they can kill you.
Except that they can lead to, brain encephalopathy, but, aside from that.
Play, Mrs. Lincoln.
So increasingly what we have been trying to figure out is, well, how can you sort of provide communities and individuals and local governance agencies with the information that they need to make changes, to make their communities healthier without waiting for federal changes, for them to sort of embrace a desire to do things differently, because we don't have to wait for the CDC level of concern to change before parents could become concerned about blood lead levels of 5 micrograms per deciliter, before health departments had strategies, before housing departments were pressured to use their housing dollars in more cost-effective ways. And tied into that is this big emphasis actually on cost-effective. With almost all of the stuff that we roll out there, we try very hard to look at ways where, rather than putting one more thing on the, everybody's platter, and everybody is so busy, especially in these understaffed, under-resourced agencies and community groups, et cetera, you have to figure out ways that they can see some sort of overall synergies that help them to perform. So, for example, we have a particular model that has, at zero increase in cost in Durham County, increased the capture rate of children with elevated blood lead levels by 600%. So you could either spend the same level of resources and have a 6-fold increase in efficiency, or you could spend 1/6 the level of resources and still do everything that you're doing right now. And that's something that the local health director, loves. He's not going to turn that down. There's no hesitation on his part to embrace things like that. So I think that providing that capacity building, providing the information, and that allows communities to self-advocate more effectively and to, coalesce and make changes without waiting for government intervention is going to be crucial.
Maybe one more question, Paul? Any other questions in the audience right here?
I followed the development of the legislation for the safe schools, and I continue to be struck by the fact that it was unanimously passed, when so often anything around environmental health is such a struggle to get passed. And you gave a recipe for success, and there were a lot of things there, but still, there seems to be almost a disconnect in the unanimous passing of that law and the refusal to pass other things. And can you speak to that at all in your experience about?
Well, I'm not sure I can explain it totally, but I think at least in this specific instance, part of it was the kid card. You know, we were playing the kid card, and I, as a pediatrician and a mom, am very concerned that we don't overplay the kid card, and that when we're playing the kid card, it's totally legit. But it does, as long as it's nurtured and cared for and not abused, really resonate with most people. And the other thing that seemed to be crucial when I was talking to the legislators was the cost. You know, and I think that speaks very much to what Marlene was saying about her 600-fold increase. We were not requiring that they do expensive things. We were requiring that they do simple common sense things that were either normal maintenance, and we were just sort of regularizing them, like sealing the CCA treated wood. And most people who have decks seal them every couple of years to protect them and preserve their life. So that was not onerous, although it met a lot of resistance from the wood people. And turning off the school buses and parking them side by side instead of end to end is basically free and actually saves money because it saves fuel. So I think those two elements were crucial in the unanimity. And then there were a couple of abstentions. But the other thing that was pretty obvious when we were talking to the legislators was they needed to know that we had already taken care of business and met the objections of the stakeholders. So it was crucial to be able to say, the School Board Association is on board with this. The North Carolina pesticide applications are on board with this. And then they would go, okay, because it sort of kept them out of hot water because we had already done that pre-work. And then we did have sort of a surprise with the wood industry that apparently didn't get wind of the bill until it already passed the House, and then they mounted an incredibly aggressive and expensive campaign, flying people in from out of state and making presentations and stuff to try to kill the CCA portion. And so we sort of had to scramble to meet that. But Senator Purcell, who is a pediatrician himself, I think helped us out a lot because he told a story about how he had a neighbor who had a dog who was tied to a fence post on a lead, and his water bucket was underneath the fence post, and he was there all the time, and it rained, and it was CCA treated wood, and the water got poisoned, and the dog died. And so I think he told that story, and everybody went, "Oh," you know? So anyway, we had some help from sort of tuned in legislators as well. It's tough. I don't know.
Don't you think one of the things the point that you made, which as I follow the work that all of y'all were doing, and Kathy is being much too modest about the important role that she played in all of this.
I doubt it.
But it was really emphasized as a children's health bill.
Right.
It was not emphasized at all as an environmental bill. And that's, I think it was crucial in the politics.
Right. It was very astute of the people who made that choice, because it really did push different buttons. But again, we have to be careful, and we sort of picked the low-hanging fruit in some ways.
Well, we're into our lunch hour, but can I ask permission to have one more question? So we had very, very little. Professor Wargo wanted one more question.
Just a quick comment. I think that the success story that you articulated is really important. And, we've had occupational law to protect workers in the workplace, but it's really curious to me that we've not thought systematically about having kind of an educational counterpart to that in the schools. And I think that the fact that kids go to school, whatever it is, 180 days per year, they're in an environment that can produce some really serious exposures. So I think that, a lot of innovation might be targeted toward the school environment that then might, float into other environments that kids frequent. Also, kids will bring home knowledge to the parents the way they did with recycling, so that there's an informational process that can occur. And one other point I wanted to make relative to the question about, why do some laws get passed unanimously as opposed to other laws having such contention, which I think is a great question, and there's not an easy answer to it. But, you know, back in '96 with the Food Quality Protection Act, remember who was in the White House? It was Bill Clinton. And remember who was in Congress? Both houses of Congress were Republican at that point in time. That statute was passed unanimously in both houses. So explaining that, you know, might take some time, but that's curious as well. So what I'm saying is that this is an issue that doesn't fall cleanly among political parties.
Let's, suppressing the desire I always have to engage in the political conversation, let's close it there and thank our wonderful panel. Much food for thought, and hopefully we can
Come and
continue
talk, or
conversations
you-
over lunch.
Oh, good.
Thanks.
It's a lovely talk, especially considering it sounds like they didn't get too much.
We also wanted to announce to everybody and